So as a social worker, you're always seeing that you're going to the poor neighborhoods, that house on the street of the poor neighborhood that's in a worse condition. And yet when you talk to many social workers or foster parents, we often feel powerless about how we're going to help families when those factors are beyond the ability of the individual to control on their own. So we're going to go through right now 7 free ways you can make a difference in under 2 minutes. You can do it as a person of any age and as an organization, so no excuses. You can take action that will meaningfully help address some of these disadvantages that you're seeing in your practice every single day. And not only can you do it, but you can get youth in care to do it, foster parents to do it, children in your own families to do it, your service clubs, your faith groups, and join us in creating a social movement where the landscape of Canada is only one of possibility and honor for Aboriginal children and not one of disadvantage and risk. So the Caring Society has these 7 free ways to make a difference. And all of these are campaigns, but they're bound by the idea of culturally based equity for children. It's about saying that every child should get an equitable opportunity to succeed and be proud of who he or she is. So here's a list of some of the campaigns. The first one is Jordan's Principle. What a lot of people don't understand is that the federal and provincial governments don't agree on who should pay for services for First Nations children, even when those services are available to all other kids without question. And too often what happens is the 2 levels of government argue, and then the child gets left out of the mix. They fall through the cracks. Jordan's Principle is named of Georgian River Anderson, and what it says is when these disputes arise and the service is available to all other kids, the child gets the service from the government at first contact, and they can argue as long as they like about getting reimbursed later. In this way, children come first. The second campaign deals with inequalities in education. Many people are not aware that education laws from the province and territory apply on reserves, but the federal government is supposed to fund it. Shannons Dream is named in memory of Shannon Dream from Attawapiskat First Nation. And she was a child who was one of 45 children in the world to be recognized by the Nobel laureates for her action she's taking to improve the education rights of First Nations children on reserve. What many people don't know is that First Nations students on reserve get about $2,000 to $3,000 less per student per year for education funding. That means less teachers. That means no libraries. It means very little science equipment or learning resources for special needs students. On top of that, the Parliamentary Budget Officer has said that the schools on many First Nations communities are in deplorable condition. Some of them are infested with snakes, with mice, with black mold. And in Shannon's case, her school sat atop a contaminated brownfield with over 30,000 gallons of diesel fuel. So Shannon's Dream is really in memory of Shannon Dream, who tragically died at the age of 15 years of age last year. But she dedicated her entire life to safe and comfy schools and equitable and culturally based education. There are now thousands of Aboriginal and non-Aboriginal children, students, teachers, and citizens who are engaging in a process of saying to the government that racial discrimination against children is not a legitimate fiscal restraint measure. And as a country, we've made a decision that every child counts and no one should be left behind. The next campaign is the I Am a Witness campaign. What we have found is that First Nations children are subject to provincial and territorial child welfare laws, but the federal government underfunds severely child welfare services on reserve, and that drives children unnecessarily into foster care, simply because they're denied the services that even non-Aboriginal families receive off reserve. So after 10 years of working with the federal government to address it, even though they were running billions of dollars of surplus or spending billions of dollars to stimulate the economy, they didn't do the right thing for First Nations children. So in partnership with the Assembly of First Nations, the Caring Society in 2007 filed a human rights complaint against the government, alleging that they're racially discriminating against First Nations children by underfunding child welfare services and giving them less benefit under child welfare laws. This case is supported by over 7,000 witnesses. And by being a witness, we're not asking you to take our side. We're asking you to go through the I Am a Witness website, read all of Canada's documents, read our documents, and then make up your own mind if after several years after the apology for residential schools, the Canadian government is doing the right thing for First Nations children. The next one is the Touchstones of Hope program, which says that, when we have culturally based and equitable funding, we need to be able to use it for maximum effect. And the best people to help us understand that are community members themselves. So it engages community members along with child welfare workers, Aboriginal and non-Aboriginal people, in developing a vision for healthy children and then being able to implement that in very practical ways. The final one is Many Hands, One Dream. And Many Hands, One Dream is basically the same as the Touchstones of Hope, except for Aboriginal health. It really guides us in being able to have the ultimate outcomes for Aboriginal children served by the healthcare system in Canada. And in fact, one of the things we're really excited about is in partnership with the Many Hands, One Dream Coalition, there's just been a release of curriculum for pediatricians. And we're hoping to be able to spread that out to healthcare providers so that they, like child welfare workers, have an opportunity to optimize health outcomes for Aboriginal children and young people. The final thing you can do is learn more, not only as a person, but as in your family unit. Engage your children in learning about the rich history of this land that's now known as Canada. Canada is a First Nations word. It means village. And it's just one of the many wonderful legacies left to all of us from Aboriginal people that have made our country good and great. So you can find out all this information on our website free of charge at fncaringsociety.com.